Hi, my name is Colleen Fuller. I'm the president of the Reach Community Health Center, and I'm very pleased to be able to introduce a video that was the product of work that's been done over the previous year during the COVID pandemic. And the video has been produced by Dr. Modupe Ayodele, who is a member of one of our committees. She was on a practicum at Reach from the Masters of Public Health program at Simon Fraser University. She also is a health professional herself. She's a dentist who is originally from Nigeria. I'm very pleased to be able to present the video, and the video is really although it was produced by Modupe and she did a terrific job, it also is the product of some of our own history at Reach. Modupe is going to explain mutual aid and the history of it and where it comes from and how it works and so forth and so on. But the Reach Community Health Center, which was set up in 1969, is actually a product of mutual aid in East Vancouver, our own community. At the time that Reach was founded by a number of community organizations working in tandem with a number of physicians, general practitioners, there were very, very few doctors who practiced east of Maine. So there was an unmet need in the community. And so people came together to work together to ensure that we all had access to primary care in East Vancouver within our own community. So that the idea of mutual aid is really part of our history at the Reach Community Health Center. When the pandemic hit, we also had some experience prior to the pandemic, which put everybody into sort of threw everything up into the air the way that we used to do things pre-COVID. During the 2010s, early 2010 to approximately 2015, Reach was working with the Metro Vancouver Alliance in Vancouver, and with the MVA, we organized a project called Listening for Direction. And what we did during that project was to go out into the community to engage with people in small groups of 10 or 12 people. We we initiated discussions with people about what things were going on in their lives, what challenges they were facing, and what changes they identified needed to happen to improve their own lives, the lives of people in their families and in their communities. This took place over a period of a couple of years. It was quite an extensive project. And one of the things that it's not that we knew it for the first time, but what we learned in a way that we would not have learned in any other way, I don't think, was that people's health is that Reach helped ensure people had access to a doctor. But how could Reach ensure that people didn't get sick and didn't need a doctor? And one of the ways to do that is to really look at all those things that determine your health, things like housing, education, public transit, childcare, um, the ensuring that people are not isolated, that they have connections within the community, and so forth and so on. And so that project was very, very rewarding in that way because we had a very good picture of what the issues were and what the challenges were within our community to keeping people safe. We call it social determinants. It can be called a focus on wellness. It can be called preventive medicine, or there are lots of different ways to describe it. So we had gone through this project and learned a lot about our community in East Vancouver. So when the pandemic struck, things were a real challenge for everybody to to maintain your relationships with people. And of course, these relationships are done in a physical way. Really, you go to meetings with people, you have coffee with people, you go to your neighbor's house, you are part of a community center, etc. All of these things were basically put on lockdown, and so we had to figure out a different way to do things, and we discovered Zoom. And so Zoom has been very, very instrumental in supporting our ongoing outreach work. Now, one of the things that we also sort of rediscovered, I would say, rather than discovered, was the concept of mutual aid. And there's a senator in the US, Alexandria Ocasio-Cortez, who, with another woman based in New York City, put together a toolkit called the Mutual Aid Toolkit. And it was basically showing people ideas about how to mobilize resources, to collectively develop strategies to ensure that people were not falling through the cracks during this COVID pandemic, because a lot of people were, and a lot of people still are. So it was a very focused effort to address some of those issues. Modupe was a part of our committee as part of her practicum at Simon Fraser. And she has put together this fantastic video about mutual aid, what it is, what its history is, what its goals are, and how other people can engage in this type of mutual aid effort. So I hope you enjoy the video. I am really proud that Reach had a role in this, and we are very grateful for Modupe for the work that she did. So thank you and enjoy.
Hello, everyone. So pleased to meet you. I'm Modupe Ayodele, and I'll be presenting the Mutual Aid Toolkit. It was actually a work from the Reach COVID-19 Ad hoc Action Committee. I'm an SFU first year MPH practicum student. So in this presentation, I'll be talking about a brief history and then the background of the mutual aid. First off, I will start with a quote from David Coates. He said, "An injury to one is an injury to all." This is a common slogan that has been used by the international working class movement, and it actually became popular in the wake of the Industrial Revolution. So what happened before the Industrial Revolution was workers were not satisfied. They had a lot of needs unmet, and they were not able to portray their grievances because they were not unionized, and the leaders were not expecting the same from them. So at the wake of the Industrial Revolution, they came together and then built union according to nationality, sex, races, and then they agreed that an injury to one is an injury to all. Another very important quote I would like to say is from Eduardo Galeano. Eduardo Galeano was a Uruguayan writer, and then he said, "I don't believe in charity. I believe in solidarity. Charity is so vertical, it goes from the top to the bottom. Solidarity is horizontal, it respects the other person. I have a lot to learn from other people." Now, this actually formed the basis of the mutual aid. The fact that it is solidarity, it is horizontal, respecting other people, and then it's not charity, which is vertical and then goes from the top to the bottom, just like the government benefits that we see today, like someone is at the top and then giving that benefit to somebody in need based on the person meeting up with some requirements. These are the things that actually formed the principles of the mutual aid kit, of the mutual aid that we see today. Introduction: mutual aid is a self-organizing tool, and it's just an essential framework for community building, and it's for the shared benefit of everyone. So everyone in the mutual aid kind of like you tend to gain. There's someone that is giving, someone is receiving, and vice versa. It's not just a one-way approach, like a vertical approach. It's more of horizontal and promoting interdependence. Brief history. Mutual aid did not just start in the wake of the COVID-19 pandemic. It actually could be traced back to Peter Kropotkin's book on a factor of evolution. Peter agreed that we only survived and evolved by supporting each other, and that we are able to actually survive better if we work collectively together. We have a better competitive edge if we work together. And an example to point here as another historical example is the Black Panthers movement. Now, the Black Panther came together was a revolutionary movement of the Blacks. And then they kind of organized the free breakfast for children, youth clinics, health clinics, and liberation schools for children. And then it was actually in an article that the programs that these people organized were they were more empowering than other government programs in their time. And then it's actually involved people coming together to work and then portray their grievances to the racist leaders at the time. And then they were able to do all this. Another important example is Saul Alinsky's organizing in Chicago. Now, Saul Alinsky is known to be the father of modern community organizing. He actually had a special approach to community organizing. And then he believed that you could actually organize a community by staying from outside, and then you organize the community. So what he focused on was the fact that if you stir up people's hunger and thirst to fight for their needs, then they are able to rise up to the occasion and then put constructive pressure on the system to take power and then get what they actually need from the system. Now, coming home to Canadian examples is the Organs Alley and then the Tiny House Warriors. The Organ Alley was an ethnically diverse community in Strathcona in Vancouver. And at the time, it was actually a very vibrant place for Black Canadians. And then you had several restaurants, you had streets, makeshift nightclubs. And then they were actually more concentrated in that place at the time because of the large proportion of Black porters that were employed at the train station. But then in the 1970s, it was actually decided to be demolished to construct a freeway that will link the main street Vancouver to downtown Vancouver. But due to collective community activism, the freeway was not constructed, but then that's why we have the Georgia Twin Viaducts. And then they were able to preserve the Strathcona and Chinatown and Gastown. The second example is the Tiny House Warriors, and they go by the slogan, "We are going big by going small." So what they do is they are just a collection of the Squamish family, and then they kind of built 10 tiny houses on wheels along the Squamish territories to stop the construction of the Trans Mountain pipeline along their route, and then to also stop the construction of the man camps. And then these two examples just show what working collectively could actually achieve for you in a community. Like when you come together, when you have the same shared purpose, the kind of programs you are able to do, and then the kind of results you are able to get. Now, more recently, mutual aid in the pandemic actually could be traced to Alexandra Ocasio-Cortez. So at the wake of the pandemic, she had a meeting with Miriam Kamba, who was a prison abolitionist. And then they came up and they designed a mutual aid toolkit because she agreed that, yeah, we cannot be isolated and survive. It's better for us to come together and survive. And then they came up with this mutual aid toolkit. And I would like to say that the mutual aid toolkit that will be discussed has actually been adapted from this mutual aid 101 toolkit. And then it's actually gained massive popularity on social media, and then it went by the hashtag We Got Our Blog. So she encouraged people to actually form pods, just small communities around their communities, to be able to ensure that they are connected even in the pandemic. Now, more recent examples of people that used the mutual aid toolkit are the Big Dog Brigade in Seattle and the West Neighborhood House in Toronto. The Big Dog Brigade in Seattle worked by Solidarity is Not Charity. And then although they were actually already involved in criminalization, queer and trans movement, building, imprisonment and all that, but they rose up to the occasion of the pandemic. And then what they did was to build social relations in response to COVID-19. So they encouraged different ports leaders, different community organizers to be able to reach out to each other and then offer help. So if you had lots of resources, you can reach out and then share your resource with someone else. And then if you had less resource, you could actually reach out and ask for something. And then the West Neighborhood House in Toronto was actually founded initially by the Presbyterian Church. And then they were, before the pandemic, involved in housing and employment programs for adults. And then in the wake of the COVID-19, they organized training for pod leaders and volunteers. So they kind of trained more pod leaders and volunteers to be able to improve community engagement in this time. Okay, mutual aid is a powerful way to promote community connectedness, build relationship. As we can see, it actually ensures like an horizontal flow of like help in horizontal direction and not like the vertical direction that we see in charity, where there is an helper on top and then a person in need at the bottom. And then there's this hierarchical arrangement where there's someone up there and then spreading down to to other people down there. So mutual aid actually promotes interdependence, like you help each other, just like you can see on the screen, like you support each other. Each person adds something to like gain and something to actually give, and then it just involves like sharing things. Now, going on to the importance of mutual aid, I will just pick on some very important ones. It promotes social determinant of health. It helps us to depoliticize our survival work. So what it entails is it actually shifts focus from the government, from waiting on the government to act. So what it does is we are able to like step in and then act for ourselves to fill in the deficiencies, to fill in the gaps of the government. But at the same time, we are able to identify these deficiencies and then put pressure on the system, on the government to act and take up their roles. So then the other example is the jail release in California, in Detroit and Michigan was actually as a result of community organizing as well. Then the Black Lives Matter campaign that we are seeing that gained so much popularity recently was actually due to like people stepping up to like put pressure and make the politicians, and that's what has led to the ongoing debate on defunding the police that we see today. And then the struggle for the Western territory against like the industrial giant as the Coastal Link pipeline is another important example. So I would like to stop here, but before we continue with the discussion, I would actually like to acknowledge all members of the REACH COVID-19 Ad hoc Committee, Colin, Jane, Janet, Malcolm, Bill, Sherry, and Daniel. And yeah, thank you. But then going forward, I would actually like to hear your opinion on what you think about mutual aid and how you can link it to the work that you're actually doing now. Yeah.
Thank you.